In 2020, 107 Pennsylvania women died from pregnancy-related or associated causes. And a recent report from the state health department shows 51% of those deaths took place after birth, and almost all of them were preventable.
Tonight, our Pennsylvania Capitol correspondent Kara Jeffords joins us live from Harrisburg, where lawmakers and advocates are celebrating Black Maternal Health Week. Kara, what are some of the solutions to address postpartum mental health and also the disparity facing women who give birth?
Mike, Eva, have you ever heard of a doula? They're a person that they learn all about the options with pregnancy, home birth, in the hospital, induced, not induced. They learn all about the health factors that you're going to come across, and then they go and they partner with someone who is pregnant to help them before birth and after. As far as disparities go, the CDC says Black women are 3 times more likely to die from a pregnancy-related cause than white women, and the Black Maternal Health Caucus thinks doulas could be part of the solution.
I felt like it was a very sterile environment, didn't feel listened to, my partner didn't feel listened to, and I just felt very alone.
Alexia Dumboya was in labor for 36 hours when giving birth to her daughter after her pregnancy.
I really could not process how I could have done something so beautiful by bringing this life into the world, but I could not make the genuine connection and feel like I could serve her in the best way.
A friend helped Dumboya identify her experience as postpartum depression a year after giving birth.
What I always say from that journey is that I decided to become what I didn't have.
That was a decade ago. Now Dumboya is a certified doula and president of CocoLife.Black, connecting and training others in the profession. A doula gives women emotional and educational support during and after their birth.
They are that voice for that birthing person throughout the entire birthing process.
In a recent report, Pennsylvania's Maternal Mortality Review Committee said that 45% of pregnancy-related deaths in 2020 were linked to mental health. National data shows doulas can reverse those negative pregnancy outcomes. The Pennsylvania Black Maternal Health Caucus is working to certify them for insurance coverage.
Doulas, we want to make sure that they're being paid an equitable wage, but also being able to be directly reimbursed by both private insurance as well as through Medicaid.
The caucus also wants to create stability in the profession by making a doula advisory board.
We just want to know the path that is taken to make sure that you're prepared to serve in those spaces.
House Bill 1608 is that bill that would expand that access to Medicaid, and it did pass out of the House committee this morning. In Harrisburg, I'm Kara Jeffords, and you're going to have more from Erie News Now coming after this break.